We started to explore different solutions in virtual reality to help patients feel better.
1, 2, 3, 4.
Our brain recognizes and remember key information 3 times better in augmented reality. I came up with the idea to make medical visualizations in augmented reality to help pharmaceutical companies present their products better. We created hundreds of such visualizations of organs, molecules, human brain, stomach in augmented reality, and helped a lot of pharma companies to explain to doctors in a proper way. So by now, our main product is AI psychologist that helps patients with depression and anxiety to feel better.
Hi everyone, welcome to Sci-Tech Suisse. It's a weekly podcast about AI technology and lifestyle. My name is Kristina Schune and I'm glad to be here with you today. Today I will explore the really essential topic. We'll talk today about virtual reality VR and augmented reality AR, how it works in medicine right now, also pharmaceutics industry, and also my guest, he will tell me a lot of details of this, how he works with it, and also how right now it works like in general. I would like to introduce my guest. This is Peter Tolochkov. Hi Peter, how are you?
Hi everyone, it's a great pleasure to be here.
He is a leader of the field of immersive technologies, and also he is the founder of Way to AR, so also a cutting-edge communications provider specializing in VR AR solutions. It's really right now sounds super complicated, but don't worry guys, I'm also not worried, for example, right now, because Peter, he'll tell us in a lot of details. Also, please, if you will say something like in the different ways, please explain what is it, because not everyone can understand, but we are really want to understand what is it and how we can work it right now. Peter, can you tell me please about your work? How did you understand that you want to work in this field?
Well, my journey started back in 2012-2013 when I launched my first medical project. We wanted to help visually disabled people to navigate through the streets better using Kinect sensors and voice feedback. At that time, technologies were not so well developed, so that project was a great experience for us, but it was a great and fresh start for me doing projects in medical field. After that, I worked for I had been working for 4 years in pharmaceutical company as a product manager, and I was responsible for patient support programs, for multi-channel marketing for doctors, and for a medical product. So I worked in one of the biggest pharmaceutical companies and get a lot of experience of how pharma company works, how pharma company looks on different points of promotion, education of doctors, etc. And that time I noticed one problem that me and my colleagues, product managers in pharmaceutical industry, we spent so much time preparing some educational materials to doctors. We spent so much money, effort, and time. And when I saw how doctors explore such materials, I was very upset because doctors are overloaded with some working with patients, with documents, etc. So,
and you want to change this?
Yes. And so I had already experience with augmented reality before, and I came up with the idea to make medical visualizations in augmented reality to help pharmaceutical companies present their products better. And in 2017, I opened Way to AR, a company that's focused on this topic, and since that, our business grew fast. By now, we work with more than 50 pharmaceuticals companies around the globe, And in 2022, we were recognized as the best health tech startup in Eastern Europe
Okay.
because we created hundreds of such visualizations of organs, molecules,
Okay.
human brain, stomach, heart, etc. in augmented reality, and helped a lot of pharma companies to explain to doctors in a proper way how their products work.
Mm-hmm.
So by now we are going on working in this field, and since 2021 we also started to work in the field of creation of patient support solutions by ourselves. I have a dream to create a really big and very, very useful digital pill. So we started to explore different solutions in virtual reality to help patients feel better. And so by now, our main product in this area is AI psychologist that helps patients with depression and anxiety, that is an epidemic of our century, to feel better, to get cheaper access to psychologistic support, and to get it on time when they need, but not to wait
I would
till
like to have a quiz.
when they can go to psychologist.
Before we start, I need to collect some information to tailor the experience. Could you please tell me your age?
I'm 30.
Just to confirm, you are 30 years old?
Correct.
What pronouns would you like me to use for you?
I am he, him.
Just to confirm, you prefer he, him pronouns?
That's right.
How's your day been so far? I'd love to hear how you've been feeling lately. What's been on your mind?
I feel sad because I'm old and fat.
I'm sorry to hear that you've been feeling sad. It sounds like this has been weighing on you for a while. When did you first start noticing these feelings?
Can you tell me how does it work for doctors? Like, for example, like you created the product, like for example, and use this product you give to your, for example, doctors, or
Yeah.
how is it like? Can you tell me about this?
Okay, we use in both segments, in augmented reality and in virtual reality. Primarily in pharmaceutical companies, we use augmented reality because approximately all pharmaceutical companies have medical representatives, special medical sales people who go to doctors and present information about pharmaceutical products. And all of them have smartphones or iPads. And augmented reality already works very good in this field. So one of important things is easiness of implementation of such innovations. Because if your innovation will significantly change the process of how current business works, they wouldn't want to make such significant changes.
Okay.
So in this case, it was easy for us to implement such solution on current devices for medical representatives. So medical representative come to doctor with iPad, and without instead of showing some presentation, spending so much time, they simply open hologram on the iPad, show the doctor it's for instance on the table, and
Why
doctor
not?
and doctor could see a human body or an organ or a molecule in augmented reality. It makes doctor very focused on this because it's unusual for them.
Yeah.
And this is a key thing because doctors, as I mentioned before, are overloaded with work and they can't pay
Attention for everything.
yes.
Yeah, it's essential stuff.
And this catches attention, and also it provides three-dimensional view on some medical process. So just 1 minute, and key message of pharmaceutical company is remembered 3 times more. It's I saw even some research that showed that our brain recognize and remember key information 3 times better in augmented reality in comparison to traditional materials.
For me, I think it's really astonishing because I also had such experience, of course, not with your field, but I also remember when I finished my master degree in Germany, I also had a diploma about immersive journalism. It's also like that people can understand immersive journalism, for example, it's almost the same, because you just like say to people that, for example, you can watch TV and you can watch just news. But immersive journalism, you can be into this. So also like in this, what you told me right now, so also like a doctor, he can be into in the sphere and he could understand more things,
Yeah.
and also like can see more. I think right now it's only like the beginning of the like,
Sure.
you know, we maybe in 10 years, by the way, I will also ask one question to you about the future. I think in 10 years, maybe already in 5 years, we'll have a lot of new things. And I think we'll never stop on this. I think it's really amazing topic and like, wow.
In
Okay.
5 years, we will sit with you in augmented reality glasses,
yes,
like
yeah.
Ray-Ban, and have some added information
Yeah.
in our
Yeah.
space.
But do you think, will it be a problem or no? For example, right now, a lot of grandparents can say, oh, right now you use like your phone with everything, you watch Instagram account, something like this. It may be also the same situation when you will be in your glasses or something like this, and you can be into always in this, and you will not have reality. So do you think, will it be a problem or no?
Of course, implementation of virtual and augmented reality is a problem for aging people. They are not. They only got used to smartphones recently, and
Yeah.
it's a new format. And by now, virtual reality is very different from user interface in comparison with smartphone. And by now, it's more complex. But on the one hand, I believe that younger generation will educate Asian people to use it. All my parents are already active virtual reality users. They don't have their personal virtual reality, but when they come to my house, they always ask to play some VR shooter or watch some VR movie.
Cool.
And when we, as a younger generation, will
We should
Yeah,
teach
we should.
them. Yeah. Okay. Nice.
like some time before, previous generation educated our parents to use smartphones. The same
Okay.
thing.
Cool. Come back to our topic, like, you know, about medicine. How do AR and VR influence the development of new drugs and clinical trials?
To be honest, in this field, AR and VR is not so important, like in comparison with other fields of medicine, because creating new drugs is a deep chemical, medical, and biological process, and there is only some supportive things like education of workers on the plants, how to work more effective, or maybe some medical visualization of a new molecular structure. But the impact in this field is not so big. In this field, I think, and I believe that AI will be the
Maybe,
breakthrough technology.
Yeah.
Yeah.
Okay, it's interesting. What specific problems of the pharmaceutical industry can be solved using AR and VR?
In pharma, I think that by now augmented reality is already a part of marketing mix and a part of educational process for both internal employees of pharmaceutical companies and for doctors. And I'm proud that our company make a significant impact on this. So for pharmaceutical companies, as I mentioned before, the main scenario is to promote and present medical information to doctors about their medicine in a better way, in a more remembered way, and faster and more effective. So they are already using this technology actively. And another type of support is virtual reality for education doctors, how to use with medical instruments, medical equipment, etc. This is also important thing for especially big medical instruments and medical tools. For instance, how to use an MRI scan properly. Because if you try and train on a real MRI scan,
Yeah.
you could harm it. You could make something wrong, and very expensive MRI scan will need to be repaired.
Yes, it's oh my God. I
Yeah.
even can't imagine how much time you should spend for this.
Yeah.
A lot.
And in virtual reality, you could try everything you want without any risk of making something.
It's also truly that right now a lot of what I can see, for example, a lot of students they want to learn what is it AI, what is it AR, VR, and right now already we have a lot of, by the way, especially in Europe and the USA, we have a lot of faculties in these spheres. So it's really interesting, and I think doctors can watch right now and can say, oh my God, we study about 10 years, like, you know, something like this, and we need to study again VR and AR. What is it? Is it? Like, you know, because it's really funny because doctors again need to learn more and more. Like, I'm so sorry, but we need to change the world in the good way. So I think it will help. Okay.
I think doctors simply spent more time before to understand this information. We are
Maybe.
not providing something new information, but we provide more easy and comfortable way to study it. Because when I present such solutions to doctors, they say that they wish they had this in
Earlier.
university.
Yeah, I got it. Oh, wow. So it's easier for them. You create not a lot of problems for them. You just
It's
create
no problem.
them. Yeah.
It's simply a new generation of doctors will be educated faster and a little bit more easier and in more interactive way.
Also useful information. Not okay, cool. Also, can you tell me many examples, for example, of diseases which, for example, doctors or like your project can help? For example, like we can take one disease, and for example, we already help with this and this and this to people. Do you have like such examples?
I have such examples in patient support field.
Okay.
Because I want to say that very significant part of AR and VR in medicine is solutions for patients' care, patient support. I want to say about 4 main areas in this field.
Cool.
Yeah.
Okay.
First of all is neurological diseases. In this field, virtual reality could help us to go to another reality, and in this reality to train some skills to expand and improve our mind. For instance, it's very good for children with autism.
Okay.
Yeah, because they could be taught with social skills in a very safe space, how to speak with different categories of people, how to ask for something, how to cross the roads, how to ask for support. So social skills in virtual reality could be trained a lot of times and in very safe atmosphere. It's very good for such types of diseases.
Yeah, of course.
Secondly, it's a rehabilitation process. For instance, rehabilitation after stroke. It's a very long and complex process, especially when you have some paralyzed hand, for instance. And in virtual reality, you could treat your brain. You put on a virtual reality headset, look at your working hand, and in virtual reality, your virtual other hand is also working, and it helps to build a new neurological connections. It helps our brain to remember how to move your paralyzed hand, and it's already used in some processes of stroke rehabilitation. Also, of course, there are some solutions in virtual reality for sports, for cardio, etc. And very important thing is mental health. As I mentioned, depression and anxiety is a pandemic, is an epidemic of our century, and a lot of people hurts from this. And for instance, our company, Way2AR, is focused on creating such solution for helping patients. We use AI in virtual reality, so it's AI VR startup. Yeah, mix to help where virtual avatar works with you as a patient and speaks with you, and virtual reality, virtual avatar use cognitive behavior therapy principles and speaks with you using AI and help you to feel better, relief from depression, anxiety, and some other mental health conditions. And we plan to expand this solution. We have a great team that works on this field for the past 2 years, and plan to be number one in this field to help tens of thousands patients to feel much more better.
Better. Wow. Do you need to pay money for this or no? For example, that they can use it, or they should pay money for this, or it's for free?
By now, majority of such projects are used in private clinics. So by now, majority is for extra pay, like doctor's consultation also. But very important thing and a signal in the market that regulators like FDA is already registered several virtual reality treatment. For instance, we have such projects in the world, Relief XR, that is focused on treatment of back pain, chronic back pain. It's a significant problem, and this company provided a virtual reality treatment solution that consists, if I'm not mistaken, from 12-week course of virtual reality treatment and some other activities that helps to reduce significantly pain in the back, and it's already could be prescribed by the doctor in the clinic. So it's not like now a positive recommendation. Doctor could make a prescription of such virtual reality treatment for patients with chronic back pain, and it's a good sign in the market that it's already possible to,
and we already can use it
to launch. And this is a truly digital pill that we also are going to create in our field.
Oh,
yeah.
What kind of challenges do you have using VR and AR right now, and maybe what you can solve already, like maybe some problems, or what maybe you're in the process right now to solving this, and maybe what we can see in the future?
Well, speaking about barriers, of course, we tackle with a lot of them, but everyone who works in medical innovation field should be very patient, meditate a lot, and
listen meditations, of course,
and remember why are we doing, why are we working in this field, to make a really good solution for patients. So I meditate a lot and believe that our solution will finally benefit a lot of patients. Speaking about barriers, one is aging population. They need much more time and effort to start using virtual reality, and sometimes they simply don't want to do it. And another type of problem is that we have also a category of doctors from aging population that also don't want to use some new innovative things. But it's simply a matter of time and matter of our persuasion. We should explain again and again why it's very good solution. We should be patient and understand that it's a difficult process for them. It's okay. We have time and we want to help them to on board on this technology. This is the first problem. Second problem is that good solution in medical field, especially using AI or virtual and augmented reality, costs a lot of money.
And you need to find sponsors also.
Yeah, still costs a lot of money. Despite using AI, despite a great knowledge all over the world about 3D modeling, it's still expensive. And because of that, clinics, pharmaceutical companies always calculate return on investment. Some of them find proper solution very fast. But for some of them, it's difficult to understand how to integrate such solution in their current business model and to have win-win between business and therapeutic solutions. It's also simply a long process of discussion, analyzing, and communication with such...
Again, to be patient and listen meditations.
meditations. Yeah.
And always when you work with people, it's always complicated.
Yes.
Sometimes.
The last thing is regulation.
Okay.
And again, be patient. And here, I personally understand, and I don't have problems with this thing, because I understand that regulation is devoted to protect us as a patients from not prepared products, because some developers are very responsible and want to create a really cool product, but some couldn't think about it in a proper way, and they could hurry up and make some mistake. And imagine if you make a mistake teaching a person after a stroke, having some depression, etc. In this field, it's very risky.
Yeah.
Because of that, regulation protects us from mistakes, and but on the other hand, it requires sometimes create a proper clinical trial of some virtual reality treatment could require 3 years. It's less than some pharmaceutical medical pills, but still it's very long, and developers should take it into account when they start this big journey of medical innovations.
Then how do technologies help to speed up the process of testing drugs and working with it?
I could even, if you want, I could a little bit expand this question about how technologies could benefit generally medical field.
Okay.
Because I have several points in this field. First, AI. AI enhances all spheres and also enhances augmented and virtual reality. More than that, by now we see that AI and VR and AR technologies are working very closely together.
Of course.
That's why we are launching. We launched the AI VR startup. Yes, and AI will change medicine significantly. From AI support for a second mind, second opinion for doctors, to some AI diagnosis tools, etc. And also AI will accelerate the process of creation of virtual reality content. And because of that, we could decrease our prices of development of such technologies, such experiences. We could do it faster.
Nice.
And because of that, we will have much more medical educational content. So this is the first thing. Second thing is augmented reality glasses. By now, we could see that a lot of companies all over the world are competing in developing some new, cheaper, lighter, and cooler augmented reality glasses. And I think that after 2030, we will sit together in augmented
just
reality glasses.
maybe normal, by the way, glasses.
Yes.
Also, because also when from the beginning interview, I also asked about some immersive situations, and also I told about immersive journalism. Also, right now is a big problem. Right now, I think in your company have the same. You have the same problem that people don't want to also use VR glasses.
Yeah.
They want to use something easier, and also that, for example, maybe for the future, if everyone want to use VR, for example, that it will be at home, but not everyone can buy this. And also maybe we can use, for example, we can sit in the underground or something like in the cafe, for example, and you can use, like, for example, normal glasses and just check all information and do everything what do you want. So it's also like really big issue, and right now maybe someone maybe will solve this, and also, but of course you need a lot of money for this.
Sure, this problem will be solved, and
Amazing.
I truly believe that there will be easy to use glasses
Yes.
like a normal one, and this innovation will help doctors to have a remote assistance. For
Okay.
instance, you work with a patient in augmented reality glasses, and you see some information about this patient, his or her analysis. And also you have AI assistant in these virtual reality glasses that also analyze what patient speaks and helps you to have a second opinion. And also you could next, when you have as a doctor time between several patients, you could put on mask on this and have a virtual reality experience to train some surgery or train some new experience in medicine. So it will be easier and widespread.
How do patients react to use of VR to simulate the effects of drugs?
Well, aging patients react in conservative way, but generally, if you show even to older patient some hologram, they're very engaged in this because they have wow effect. You simply should show it to him or her by yourself and try not to give a iPad to this person because
maybe you also need to explain, for example,
or spend time to explain how to use it. But everyone is surprised when they look at the hologram. But you should spend time to explain. But it's really a good technology to explain complex processes in an easy way and in remembered way. So patients also like it, especially doctors like it, to explain patient, for instance, some complex medical process. For instance, to explain why this patient feel badly and how to treat it. In this way, patients become more ready to some therapy.
How can you see this field in 10 years?
Recently, I wrote an interesting essay. I think I'll share it soon with you.
Amazing.
I see a significant impact of AI on our healthcare industry. I see significant impact of merging AI and immersive technologies. For instance, I truly see that in 10 or 15 years, you could go to the clinic, spend an hour here, get a full scan of your body, get a full results of each issue that you have, get a personalized AI plan of
Okay.
how to treat everything, get an AI companion who will guide you through this process and help not to forget to take a medicine, to take a rehabilitation thing. And doctor will simply like a strategic partner of your health, who will see a big picture and help you to feel much more better and coordinate such technologies. So personally, I believe then in 10 and 20 years, I will feel better than I feel now, because I'll fix some issues that I have now, and I wouldn't have new issues because I'll be under more control of some new sensors, like new technologies and AI that will control my body. So I feel very optimistic about health of a lot of people.
I want to say thank you so much for this
Thank you.
video. Thank you to Peter to being here with us with Sci-Tech Suisse. And if you have any questions, please ask. Also, like, please write comments. Do you want to? What do you want to see? Maybe you have some questions. What you didn't understand? What you understood correct? So we are really interested in this, and we use your opinion. Thank you so much also for watching this video. Please share this video with your friends. Give me a like and give some comments. See you. Bye.
Thank you. Bye bye.